Count full-time employee, or small business, 25 employees for small business tax credit, I said that. Count full-time employees. So if you want to figure out what you have, you start with counting full-time employees, 30 hours per week. And then we're going to aggregate the part-time, so I'll get to that in a second. Count employees who do not work full-time, but dividing the aggregate number of hours worked for a month by 120. Where's 120? The IRS, for some unknown reason, thinks there's only 4 weeks a month. Right, well, breaking news to you guys, there's about 4.5, sometimes even 5. But nonetheless, we're doing easy math. So you take the employees you have hour count after full times and divide that by 120. That's your full-time equivalents. That gives you your number of employees. And that's for a month or period. And you seasonal employees may not count. In fact, they probably don't. That was a definitive answer. The only guidance right now on seasonal is that if a seasonal employee takes you over a limit, you can nullify that seasonal employee. What's a seasonal employee? That's a whole new question. I guarantee you we're going to have a lot of employers using seasonal employees as a way to get around healthcare. How do you purchase an insurance in the future? Defining you. What is you? I get this question a lot. How are we, or how are you going to buy health insurance? It depends on who you are. If you are Medicare or Medicaid, it's going to stay the same. And it's going to run out of money. Individual market. It's difficult to receive insurance now. Insurers in Oregon do not have to give you individual health insurance if they don't want to. They have what's called a whole high-risk pool in Oregon, and they all pay a tax to avoid having to cover people they don't want. And that's not a shot at insurers, it's just a law, so why wouldn't you? So unless you're really, really healthy, unless you're 21 years old, or have some other factors, it's really difficult as an individual to get individual market health insurance. And they all have a limited number of plans because they don't make a lot of money on them. Group market is purchased through small employer health insurance, CHI, as I use, if you're insurance CHI, that's what we're talking about, or a larger group market is self-funded or consultant-driven. We have these things called state-based exchanges in law. You hear the word exchange. Exchange is really Mike back there selling you health insurance. It's just really a big consultant. And whether they'll outsource it through actual consultants or whether they'll create a department of government will really depend on largely probably whether a Republican or a Democrat in the Congress or in the White House at the time, in the state legislature. Because those are real government democratic principles. Big business outsource the competition, or do we have an oversight government that runs it? But one way or another, it's a place you buy health insurance from. I'll get in, I don't think I should have my slide on consultants now, but you're really going to be faced with the issue on your consultants of, do I buy through somebody who buys through the exchange, or do I buy directly through the exchange? They're going to be basically a menu. You'll have, Kaiser $100 deductible. It's going to cost X per month. Kaiser $200 deductible this month. Pacific Source $250 deductible this month. That's what the exchange will look like. It'd be like buying anything else online. Better not. Individual small employers by 2014. So 2014, all small employers will have an opportunity to buy through an exchange. The idea here is that lower cost will lower about 3 to 4%. Because we're going to pool a lot of you together. Why I said PEOs were the real pioneers of healthcare reform is what you've been doing all along with the PEO. You're going to pool with lots of other employers, costs are going to go down. And coverage is going to go up because we no longer will have these CHI mandates. Then we need to mandate certain things to keep costs at a certain level. So you're going to have an opportunity to provide better coverage. So as a small business, I think you are far better off, if this all holds true, buying insurance through an exchange than you are today. So as I'll get through this, if you have 50 or less employees, I tell you, I think I'd keep health insurance. I don't care whether you make your employees pay 100% or you pay it all for them. That's your decision. But you're going to be better off through the exchange than as a small business than you are buying your own individual coverage through the exchange.
And when you say better, is that talking about cost side?
Cost and benefits. You're going to have lower cost, better benefits than likely if you buy it as an individual on the exchange due to the pooling and small business provisions. And I'm guessing, and I don't know what Tinian's, for example, PO plan will look like. I'll bet theirs will even be better than that because they're going to be pooling on a different level. And probably eventually buying in the large employer exchange market in 2017. Access to multi-state plans. If any of you have operations in multi-states and you have insurance, it's really, really annoying to buy a Kaiser Washington plan, a Kaiser California plan, a Kaiser Oregon plan, for my 3 employees in Oregon, my 2 employees in California, my 8 in Washington. Because unless you're really Vancouver and Portland or cities on the border, it's very difficult to cover both under one contract signed in one state. These new rules are going to provide openness to that, which is really, really good news if you have multi-state employees. So now we're going to talk about what's called grandfathering. Grandfathering is a concept, and I've always ran on this because I love my mother to death. They never call it grandmothering; it's terrible. It should be grandmothering, not grandfathering. But we always use the male-dominated grandfathering. Plan on which March 23rd, 2010, had at least one active benefit participant. So how many of you in this room? This is a show of hands time, and I'll call on people who don't raise their hands. Have health insurance right now? How many of you have one employee on the health insurance? So all of you that raise your hands the second time have a grandfather plan. I don't care what you do to it. I don't care if you change the deductible. I don't care if you change the provisions. As long as you don't cancel the plan. And the plan is the umbrella. It's not the insurance contract with Pacific Source. It's the plan. As long as you don't change the plan, you have a grandfather plan. If you're in this room and thinking about having health insurance for an employee in the future, you do not have a grandfather plan, and you're subject to a whole bunch of other provisions than the ones that are grandfathered. So it will be virtually impossible, provided regs don't change in this issue, from now until 12/31/2013 to destroy your grandfathering status. The only way you'll do it is by shifting your umbrella, which is an ERISA term, not a state term. Determined to provide essential health benefits. Now this was a provision vastly changed in the law. If you came in this room and one of your questions was going to be, how much minimum coverage do I have to apply, give to my employees? That was changed in the reconciliation bill. Essential health benefits now means this. And that's not a lot. Well, it's a lot of big words. That's really basic health care. If you provide ambulatory benefits, emergency benefits, mental health, which you have to read by mental health parity, rehabilitative, preventive, wellness, pediatric services, people in a hospital, maternity, newborn care, you're really describing basic health care. You'll see in there you're really not describing a lot of outpatient surgery. So a lot of your real high cost benefits don't need to be provided now to have what's called essential health benefits. As employers, we walk through this here in the next 20 minutes, that's what you have to meet healthcare plans, which is relevant in the penalty section.